What if I told you that the glass you drink from every day without thinking might be helping or worsening your back pain, headache, and even that sciatic nerve that seems to catch fire and run down your leg? Many people come across my content searching for a home remedy for herniated discs, looking for a quick, cheap solution that avoids surgery at all costs. And I understand. Constant pain is exhausting, dampens your mood, disrupts sleep, and the whole life revolves around finding a tolerable position. I am Edu Rodriguez, a pharmacist and health educator, and in this video, I want to explain simply how proper hydration can help your spinal discs, what is a myth in the water with salt story, and most importantly, what kind of movement usually relieves, and what kind of exercise can worsen sciatic nerve pain if done incorrectly. All of this is health education, not as a substitute for your doctor or physiotherapist. Before talking about a glass, water, and salt, we need to talk about surgery. When a person receives a diagnosis of a herniated disc, fear hits hard. The mind already imagines a scalpel, screws, hospital bed. But the truth is that, in most cases, the first course of action is not surgery, but proper conservative treatment, medications when necessary, physiotherapy, routine adjustments, strengthening, habit changes. In many studies, a large part of herniations improve over time when the person is properly monitored, respects their body's limits, and completes the treatment. However, the decision whether your case requires surgery or not is made by the specialist examining you, reviewing your MRI, and mainly assessing your symptoms. What type of situation makes surgery a priority? For example, when a hernia is compressing the nerve so much that the person begins to lose strength in the leg, loses control of the foot, has severe muscle weakness, loses control of urination or bowel movements. In such cases, time is a critical factor to save the nerve. In these situations, the conversation is different. Now, if your case involves pain, tingling, discomfort, but you can move your legs, walk, stand on tiptoe and on your heels, most of the time there is room to try everything in conservative treatment before considering surgery. And that is good news. Let's take a calm look at the disc in your spine. Imagine a shock absorber between each vertebra, like a babaloo that is resistant on the outside and much more gelatinous on the inside. This core is very rich in water. In a healthy, young, well-hydrated person, this disc is full of fluid and appears quite white on MRI. It absorbs impact, helps the vertebrae slide, and distributes the load when you sit, stand up, twist your torso, walk, or run. When this disc dries out and loses water, it becomes more mushy and appears darker on MRI. If the pressure on the front of the disc is constant, often from sitting hunched over, carrying weight improperly, or poorly guided weight training, this core can be pushed backward and start to touch the nerve, the famous hernia. Here's the key point. About 70 to 80% of the structure of this disc is water. If the entire body is chronically dehydrated, if you spend the whole day thirsty and ignore it, if the only liquids you consume are coffee, soda, or very sweet juice, guess who suffers silently? Your discs. Frequent headaches, feelings of fatigue, cramps, all of these can be related to poor hydration, among other factors. And there is no healthy disc without enough water circulating in the body. This is where the idea of mineralized water appears on social media. The famous water with whole salt in the morning on an empty stomach, as if it were a miraculous remedy for herniated disc, migraines, sciatic nerve, and half of the planet's problems. I need to be very honest with you. Drinking water properly throughout the day is essential for the disc, the brain, the intestines, and the muscles. And yes, in some specific clinical situations, adjusting the amount of salt and minerals in the diet can make a difference in cellular hydration. But turning this into a promise to cure a herniated disc with just a glass of salt water is a dangerous exaggeration. Why? Because salt is sodium, and excess sodium, especially in people with high blood pressure, heart problems, or kidney disease, can worsen, and significantly, the condition. What might be an interesting strategy for one well-assessed person could be a disaster for another. So, the first message is, there is no universal home remedy that safely works for all people with a herniated disc, much less one based on salt. And no one should hide that from you. What is safer for most people, and what almost everyone neglects? Drinking water throughout the day in small portions, starting in the morning before coffee, and respecting your body's limits. No chugging 2 liters at once. If your kidney function is normal and you have no water restrictions, a common target used by many professionals is around 2 liters per day, adjusted for weight, climate, and physical activity. For many people, this is already more than double what they currently drink. Starting the day with a glass of water, pure and at a pleasant temperature, is already a first step to get the system out of chronic dryness. And where does whole salt fit into this story? Some people, when evaluated by a healthcare professional, may benefit from slightly mineralized water with a pinch of unrefined salt, especially if they sweat a lot, engage in intense physical activity, or have a diet very poor in minerals. This type of water can help replenish electrolytes and hydrate cells. But I repeat, this is not a protocol for everyone. If you have high blood pressure, kidney problems, heart issues, take diuretics, or use medication for blood pressure, this practice may be contraindicated. Therefore, if you are tempted to try water with salt, do it the right way. Talk to your doctor or nutritionist first. Explain what you saw on the internet. Ask them to evaluate if it makes sense in your case, and if so, how to do it. Now, let's step away from the glass a bit and look at the moving column. A herniated disc isn't just a lack of water. It's also an excess of incorrect load, poor posture, and poorly directed effort. When the sciatic nerve inflames, the pain radiates down the leg, accompanied by tingling and a shock-like sensation. Many people become immobilized in bed and think the solution is to stop moving altogether. And then they spend days and days lying on the sofa or in bed in fetal position, afraid of any movement, which tends to worsen stiffness, weaken the muscles even more, and in many cases, increase the pain. The good news is that modern physiotherapy, based on movement, has very well-structured protocols that utilize movement to your advantage. One of them involves extending the spine, the movement where the torso leans slightly backward, helping to stop the disc material from being pushed backward all the time. In many people, this reduces radiating leg pain because it affects the pressure on the nerve. However, this must be done carefully. At home, without diagnosis, without assessment, the idea is not to start doing anything haphazardly, but to help you understand the reasoning, think in steps. In a very severe crisis, sometimes the most tolerable position is lying face down, with 1 or 2 pillows under the torso, without forcing anything, just allowing the spine to get used to a slight extension. When the pain begins to allow it, some professionals advise supporting yourself on your elbows, as if in a sphinx pose, keeping the hips against the mattress, taking deep breaths, and observing whether the leg pain diminishes or not. Only then, and always under supervision, would movements be introduced where you stretch the elbows and lift the torso higher, keeping the pelvis pressed against. It's the kind of progression that is miraculous for some people and terrible for others. What is the criterion? If the pain that radiates down the leg gradually moves back towards the spine, it's usually a good sign. If the pain worsens, descends even further, and becomes more intense, it's a sign that that movement is not suitable at that moment. You can't figure this out over the internet. You need a professional to handle your case firsthand. On the other side, there is a type of movement that is usually treacherous for those with a herniated lumbar disc with inflamed sciatic nerve. Trunk flexion exercises with load, such as touching your foot with your knee extended, doing a classic abdominal crunch, pulling the trunk forward, or using those lumbar extension machines at the gym without guidance. When you bend your trunk forward with weight, you compress the front of the disc and push the core even further back, exactly in the direction of the nerve. That is why so many people leave the gym worse off after insisting on the wrong exercise. So, an important message. If you have a diagnosis of herniated disc, take your exam to the physiotherapist or physical trainer. Ask them to write down what is recommended and what is prohibited for you, at least at this stage. Just because the device is called lumbar doesn't mean it's good for any lumbar. Now, put the pieces together. A chronically dehydrated body, combined with years of poor posture, long periods of sitting, little movement, and incorrect exercises, is the perfect recipe for a dried out disc, hernia, irritated sciatic nerve, and a headache as a bonus. A smarter care plan involves 3 pillars working together: proper hydration with water throughout the day and individualized mineral adjustments, the right movement in the right direction, respecting signs of improvement and worsening, and disc protection, avoiding exercises that push the problem into the wrong place. None of this is magic. It's not a glass that will cure a herniated disc. It's not an exercise seen in a video that replaces personalized physiotherapy. But small decisions repeated every day have a huge cumulative effect. Drinking real water instead of just soda. Getting up from the chair every hour to walk for a few minutes. Replacing movements that worsen sciatica with movements that relieve it. Adjusting weight, taking care of sleep, strengthening the body as a whole. That is what, in the long run, changes the story of your spine. If you've come this far with back pain, with sciatic nerve throbbing, or with an MRI showing a herniated disc under your arm, I want to encourage you to do two things. First, find a trusted doctor and physiotherapist, explain your symptoms, show your tests, and develop a serious care plan step by step. Second, use what I shared here as a basis to ask better questions during your consultation. Ask about hydration. Ask about extension exercises. Ask which movements you should avoid. When you understand what is happening with your body, you stop being a passenger and become the protagonist of your treatment. If this video helped you see a herniated disc in a different way, take the opportunity to subscribe to the EDU Dicas Desad channel, leave your like, and share it with someone who constantly complains about lower back pain, sciatica pain, or endless headaches. Sometimes, a clear explanation is the first step for the person to overcome fear and start taking action. And now I want to hear from you. What is your biggest challenge today? Drinking water throughout the day? Understanding what exercises you can or cannot do? Or dealing with the fear of surgery? Tell me here in the comments, because based on your responses, I will prepare the next videos to help you in an increasingly practical and feasible way. Remember, more movement, more knowledge, and more care for your body often mean less pain in the future. See you in the next video.